Hi, I'm Dr. Erica Bruner, and today's frequently asked question is how often should we treat with acupuncture and what should we expect, when should we expect to see results? Um, that can really depend on the severity and the acuteness of the problem. If the problem is an acute, painful injury like neck or back illness, disc disease, it's really good to treat 2 to 3 times a week, but it will tend to respond very quickly, and often we only need to go on that schedule for maybe 3 to 5 treatments, and then we can go to less often, maybe once a week or every 2 weeks, or maybe even we'll be done at that point. For longer courses of problems, things that have been chronic, that have been going on for quite a while, weeks, months, years, older animals who, maybe don't respond as quickly as younger animals do, I typically think that it's probably best to start with 3 to 6 treatments about 1 to 2 weeks apart. And if we're going to go at a longer interval, we probably should do more treatments. And the reason is that there's a certain kind of momentum that we can gain by treating more frequently in the beginning. So if we have a certain level of improvement and then we start to decline again, if we catch that patient before they go back down to where they were, we can sort of build on that improvement. And so it usually takes about 3 to 6 treatments to really see that significant elevation of improvement. And at that point, we'll reassess and maybe try treating less often, maybe every 2 or 3 weeks, depending on how someone's doing. If we've been seeing steady improvement and we think that they might still continue to improve, we might continue the weekly or every 2 weeks treatments for a while. And then, with older animals, maybe we'll reach a certain plateau where we feel like, okay, they've improved as much as they're going to and they're stable and steady. Then we'll try to find a maintenance interval where we'll decrease to every 2 or 3 or 4 weeks and see. Very often people can tell when their pet starts to kind of go down again. They can see a visible difference and a decrease in comfort or function, and so that usually is how we figure out the ongoing regular treatment interval. Not everything needs to be treated on an ongoing basis, of course, but since the majority of my patients are older and they have these chronic issues that have developed over many years, I do continue to see benefits even out, 6 to 8 months, a year, 2 years from starting treatment. It's not as rapid as we see in the beginning, but we will still see changes coming through, positive changes, even months to years after starting treatment. Hope that answered your question. If you have more questions, let me know. Feel free to submit a question for this series at info@heartofvermontvet.com.